Good afternoon, everyone. I'm Nirav Shah, the Director of Maine CDC. I'm delighted to join you this afternoon to provide an update on where we are with respect to COVID-19 for the state of Maine for today, Thursday, April 29th, 2021. And I begin on a sad note today. Maine CDC is reporting 4 additional deaths among Maine people with COVID-19. 3 of them were residents of Androscoggin County. 1 was a resident of Kennebec County. 3 of them were women, and 1 was a man. 1 was someone in their 20s. 1 was in their 40s, another in their 60s, and 1 in their 70s. Their passings bring the total number of deaths associated with COVID-19 in Maine to now 782. I'd like to take a moment to offer our deepest condolences to the friends, family members, and communities of these 4 individuals, as well as all 782 who have died over the past year. Right now in the state, there are a total of 60,946 cases of COVID-19, representing an increase of 254 cases since yesterday. Cumulatively, 1,840 people have been hospitalized, and right now, 125 people are in the hospital with COVID. 46 of them are in an intensive care unit, and 15 of them are on a ventilator. Our test positivity rate for PCR tests has been holding steady. It now stands at 2.59% on a 7-day basis, with a testing volume of 672 PCR tests for every 100,000 people in the state. And in terms of our vaccines and vaccination activity, we've administered well over 1.1 million doses of COVID-19 vaccine. About 626,000 of them have been first doses. And as of this morning, 501,726 final doses of COVID-19 vaccine had been administered. To put some of those numbers in perspective, what that means is among all Maine people 16 and over, that is to say those who are eligible, 55.7% have received their first dose, and 44.6% have received their final dose of COVID vaccine. But there's a lot of differences amongst age groups within that group. Among people who are 50 and over across the state of Maine, more than 2 out of every 3 Maine person aged 50 and over has received all the shots they need. 2 out of every 3 Maine person aged 50 and older has received all the shots they need. But among people who are 16 and 17, or in their 20s or 30s or 40s, only about 1 in 5 has received the shots that they need. So if you're on the younger side, in your 20s, 30s, 40s, and you are watching today, you're not sure whether to get a vaccine. Maybe you've heard that young people don't need to be vaccinated. You've heard people falsely say that young people don't need to be vaccinated. I'm here to tell you today that you should get the shot. As we've talked about, sadly, just in the last week, 2 people in their 20s in Maine have died with COVID-19. 2 people. Before that, it was only 1. COVID is spreading rapidly amongst younger people in Maine. And even though you may think of yourself as healthy and not at risk, COVID-19 shouldn't be measured just by the deaths that it causes. If you get COVID, you may have to be out from work for a long period of time, away from school for a long period of time, away from your friends, away from your family for a long period of time. A lot of people have long-term symptoms related to COVID-19, symptoms that can stretch on for weeks, months, where they're still not feeling quite right. But even if you do avoid all of those things, what about the people in your life who are vulnerable? People for whom they may not be able to get a vaccine. They haven't been able to get a vaccine yet. Maybe it's your parents or your grandparents. Maybe it's people that you work with. All of those people can get protected if you get the COVID-19 vaccine. So that's why I want to take a minute today to urge those who are in their teens and their 20s, 30s, and 40s to take a second to go get a shot. we're doing everything we can to make getting the shot the easy choice. Things like walk-in hours where no appointment is needed, finding time after hours because we know a lot of people are working. And so we need to make plans so that the vaccines can be made available at a time that works for you. For example, our site down in Sanford at the old Marshall store there in Sanford is going to be offering not just walk-in hours, but evening hours this evening from 5 p.m. to 8 p.m. Another spot that I know is accessible for a lot of folks is at the Portland Expo, where similarly, no appointments are needed. And for example, at the mobile unit. The mobile unit has been wrapping up its tour of duty in the Biddeford area. I'm really proud of the success that they had. Overall, the mobile unit, while it was stationed in Biddeford at the Biddeford High School, provided 2,277 doses of J&J vaccine. It finished really strong yesterday with 561 shots that were administered. It's going to be today on its way en route to Freiburg at the fairgrounds there, and will open up Friday morning at the fairgrounds there, administering the one-shot J&J vaccine. As with Biddeford, appointments are not needed. Walk-ins are encouraged. So if you're in that age group, we're in your 20s, 30s, and 40s, you're not sure about whether you need to get the shot, where to get the shot, how to get the shot, I want to talk to you today to let you know that you should get the vaccine. Getting the vaccine is more convenient than it ever has been, whether it's at your neighborhood vaccination site, a local pharmacy, or your local hospital. And getting the shot not only keeps you safe from getting COVID because it's circulating among younger populations, it also keeps people in your community, people in your lives safe from getting COVID as well. When we all get the shot, our chances of spreading COVID and having outbreaks goes down that much more. Every person who gets the shot gets us that much closer to being done with the pandemic. So I'm asking everyone who's in that younger age group to take a minute today, find a spot, and go get the shot. So with that, I would like to turn things over to our colleagues in the media. The first question for the afternoon goes to Patty White.
Thanks, Dr. Shah. Maine is performing pretty well in terms of the pace of vaccinations, but we all know it's a race against the variants. And I'm just curious, what % vaccination is your goalpost for Maine being in a good place? And when is your target date for reaching that?
In terms of the percentage, it's in that 75 to 85% band. Now, I don't want to stop there. Let me be really clear. If we get to 85%, we're not going to turn the lights out and go home. I'd like every single person in Maine who wants to get vaccinated to get vaccinated. And I'm hoping that is as close to 100% as possible. That's our aspirational goal, to get to as close to 100% as possible. But for epidemiological purposes, when we get into that 75 to 85% band, that's what gets us closer to that population level immunity. So it's two goals, Patty. The first is the epidemiological goal of being in that 75 to 85%. The second is the aspirational goal, what I think we should all strive for, which is every single person in Maine who can get vaccinated, getting the shot. Now, in terms of the timeline, that's a little bit trickier because it does depend a bit on things like vaccine supply. Sadly, vaccine supply has not really changed appreciably in recent weeks. We're hoping that as we get into the summer, we start seeing increases in our supply of vaccine. So, right now, what we're anticipating is that around Memorial Day, we're hoping for about 2/3 of the population who's eligible, having had their shots. And then after that, keeping up in stepwise fashion. But if we get an increase in supply, Patty, then we'll be able to accelerate. Or in addition, if the vaccines are authorized for younger populations, say 12 to 15-year-olds, we're going to be in position to start offering the vaccine to them as well. So that when question, it's a bit of a moving timeline based on in whom the vaccine is authorized and how much more vaccine we get.
Okay, thanks. And then I've got a couple questions about vaccine hesitancy. I've heard from some people who are worried about variants, and that's actually a deterrent from getting the vaccine because we don't know which ones will emerge and whether the current vaccines will be effective. I'm just curious, what's your response to that concern?
Well, I hear that, and let me speak right to that, Patty. The best protection that we have right now against variants is the vaccine. Full stop. Indeed, the vaccines that we have right now, the three that are authorized in the United States, have shown very strong effectiveness against the majority of variants that have been categorized. Indeed, the ones that are circulating in Maine, the one that was first identified in the UK, the one that was identified in Brazil, and a third that was identified in South Africa. Those are the principal variants that are circulating here in Maine, and the three vaccines are extremely effective against all of them. It's possible that as we go on, there will be yet another variant that theoretically the vaccines that we have may not be effective against. And that's where the talk of things like a booster shot comes in. But let's worry about that when we need to worry about that. Right now, the concern that we have squarely in front of us are the variants that are already circulating in Maine. Now, Patty, I know that there is discussion out there about what's going on in other states. Indeed, or what's going on in other countries. And shouldn't we be afraid about that? Well, we should be concerned. But variants emerge when not enough folks are vaccinated right here. Variants spread when not enough folks are vaccinated right here in Maine. So the finest thing that we can do to tamp down on the variants right now is for people to get vaccinated here in Maine. We should still be concerned about what's spreading in other parts of the world or in other parts of the country, but variants can start escaping and causing problems right here in Maine. So that's where we should really be focused. And we've got the tools at our disposal right now to get a hold of that.
Okay, and one last question about hesitancy. I've also heard some people who are worried about long-term side effects, that the vaccines haven't been used long enough to really know what could be coming down the line. So for them, it's more of a matter of time. I mean, what would you say to that concern, that we just don't know enough?
Yep, I get that. I mean, I think we are, that's a reasonable question. It's something that we've talked about. I understand where that question comes from. We've had the vaccines now they've been in development for about 13 or 14 months. They've been authorized now for about 5.5 months. It's reasonable to wonder what the long-term effects may be. But the bottom line is this. One, the side effects of vaccines, the vast majority of them appear in the first 15 to 30 minutes after you get the shot. In a small handful of cases, 15 to be exact, associated with the J&J vaccine, there have been some people that have had blood clots about 2 weeks after their vaccine. But long-term effects of vaccine are not really seen. The effects, to the extent they happen, the cold chills, the fever, things of that nature, happen in the first minutes to days rather than weeks to months to years. The other thing to think through, though, is that although it's reasonable to wonder and be concerned about the long-term effects, I think it's also right to ask, what are the effects of not getting vaccinated? If you're a younger person and you're weighing the concerns about getting vaccinated versus not getting a vaccine today, I think it's important to note that we had a number of deaths just reported today. And in the past week, 2 people in their 20s have died with COVID-19. That has to be part of the calculus as well.
Thank you.
Over to Patrick Whittle next.
Thank you very much. A couple of things. We've noticed from data from Johns Hopkins University that the daily caseload has dipped somewhat over the last couple of weeks after trending upward, sort of in like the kind of post holiday time. I'm wondering if your own data also bear that out, and could this be sort of the slide that keeps on sliding as opposed to the sort of yo-yo we've been on?
Well, yes, Patrick, but it's a very cautious and qualified yes. Here's why. As a state, it's true. Our 7-day average of new cases has come down. That's a good thing. Our 7-day positivity rate has come down, but we're not out of it yet. Hospitalizations are still high. That number has not come down, and it may not come down for a while because that's a lagging indicator. We still reported a sad number of deaths, but here's the real concern I've got, Patrick. It's the Androscoggin County area. Although things have eased in Androscoggin County as compared to 2 or 3 weeks ago, when much of the outbreak was related to an outbreak at Bates, as well as other associated outbreaks in the county, things in Androscoggin County are still concerning. The rate of new cases over the last 14 days per 10,000 people in Androscoggin County is 90 cases per 10,000. The statewide total is only about 38. So that's a concern. The positivity rate in Androscoggin County is higher than the statewide positivity rate. The positivity rate in Androscoggin is 3.5%. And as I mentioned, the statewide positivity rate's around 2.5. It's not that much higher, but it's concerning. So I guess, Patrick, you're right. As a state, we're overall heading in a better direction than 2 weeks ago, but there are still areas of concern. There's heterogeneity within the state, and a lot of our focus right now on a disease control perspective, as well as on a vaccination perspective, are focused very squarely in Androscoggin County.
You said during a Maine public appearance yesterday that graduation season is going to look different this year than it did last year. Possibly these events can actually happen. They can happen outside. People can move their tassels and do all those things. Can you talk a little bit more about what the safety guidelines are going to look like and exactly what graduation season could look like at high schools and colleges?
Yep. Well, I think the key as we think about summer gatherings, whether it is a graduation event or the other things that we love to do outside, which I want to encourage people to do, the key is to try to keep distance. Again, we've removed the mandate for outdoor masking in recognition of vaccination rates and the much lower transmission. But that should not be taken as a suggestion that life as it was in 2019 outdoors can be the same in 2021. So a tightly packed outdoor event where people are seated right next to each other, that's still a risk. Graduation events and other type events that are occurring outdoors where people are still spaced out. Now that's an opportunity to have the event as well as to keep the risk low. So my recommendation, or the recommendation that we are working on putting out more formally through the checklist group process, is for events like that to consider if they are going to hold it, to A, try to hold it outside, and then B, make sure that there is that 6 feet of space in between folks, as much space as possible, to try to reduce the likelihood. By doing that, you can have the event and make sure that there's not an unsurprising type of transmission of COVID that occurs.
I got it. One final thing, we've seen sort of varying approaches to the subject of vaccine passports around the country. Has there been any movement at the state level to try to tackle this?
No final decisions yet. We are still pretty squarely focused on getting folks vaccinated. We're having discussions around what any sort of process of that nature may look like if we even go down that pathway. As you're aware, Patrick, there have been concerns that have been outlined. There have been benefits that have been outlined. On the benefit side, it may allow folks who have been fully vaccinated to demonstrate that and then get access to certain events. But on the concern side, we don't want those events to be essential features of daily life. If you need to prove that you've been vaccinated in order to go into a government building, well, that may cut off a swath of the population that for whatever reason has not been or cannot be vaccinated. So we've got to balance this access to essential services. There are also concerns, of course, around data safety, security, things of that nature. There's a lot of moving pieces. Some states have voiced more vehement concerns than others. I think we're still in the evaluation phase right now.
Okay, good to know. Thank you so much.
Thanks, Patrick. Over to Eric Russell next.
Good afternoon, Dr. Shah. I wonder if you have any insight into the deaths that we've seen recently among some of the younger people. We've had a couple of people in their 20s. I think there have been some in their 40s. without giving anything away that would identify them, do you know if there were some other conditions that might have contributed to their deaths as well? Or is it just, a stark reminder that, even young people are at great risk potentially?
And at least in one of those instances of deaths that we've reported in the prior week among people less than 50, in one of those instances, the individual had a pre-existing medical condition, but not one that would have normally led them to pass away, but they did have a pre-existing medical condition. But in the others, Eric, what you noted is the predominating story, which is that it is a stark and sad reminder that COVID is circulating much more widely among younger populations. It is leading to hospitalizations among younger populations. And as the last week or 2 weeks of data have shown, it is causing deaths in younger populations as well. As the virus circulates, more younger people will get infected. A subset of them, sadly, will be hospitalized, and a subset of those who are hospitalized, unfortunately, will die. And that is sadly what we are seeing.
Thank you. The other question I had to do with April vacation. I think throughout the pandemic, we have seen patterns of case spikes after school vacations or major holidays. And, I'd be shocked if you weren't thinking about this already. And I wonder, it's one of those things, if it's going to happen, it's going to happen. But is there anything that can be done to sort of, stanch that a little bit? Or what are you guys thinking?
Well, it's interesting, Eric, because I respectfully sort of see it a little bit differently from how you framed it, because if it is one of those things that's going to happen, I think we can mitigate some of that risk to others if a family comes back and may have picked up COVID or something of that nature. And the way we do that is through pretty widespread or blanketed testing. If your family has just come back or is coming back from a vacation and you're worried that you may have been exposed while you were out, no matter where you were, in Maine or elsewhere, getting tested is the easy option. Testing's still available at pharmacies, at many testing sites, our swab and sends. Testing is the easiest way to reduce the likelihood that your family may pass it on to your neighbors if you're hanging out with them, or that your kids may inadvertently bring it into school. So testing is really the key there. And testing remains available, remains free of charge and virtually everywhere. That's got to be the key. So if you're coming back and you're worried and you want to make sure that all systems are a go before you get back into the normal swing of things here, getting tested is the way to do it. It's not too late. I know, we're latter half of the week, but it is not too late to get tested at all.
Just a quick follow-up then, is it a good idea for people to go ahead and get tested anytime they come back from out-of-state travel? I'm thinking as people, get into the spring and summer months and they're thinking about traveling, what's the harm in getting a test as soon as they get back? Is that a good strategy?
If you're vaccinated, then there's really no need to do so as a matter of policy. If you're not fully vaccinated, if you are fully vaccinated, there is, as a policy, not really a need to do so. But if you or your family are not fully vaccinated, then yes, if you're coming back from a travel and you think you may have been exposed, you may have been in a crowd, something of that nature, and your daily life back here in Maine involves exposure to others. So you're not working from home, but you're out and about. Maybe you're a frontline worker, maybe your kids are in school, then yes, getting tested is a smart thing to do. It's an easy thing to do. And in almost every situation, it's a free thing to do too.
Thank you.
Over to Jessica Piper at the BDN next.
Thank you, Dr. Shah. First up, I wanted to follow up on one of the things you had said in response to Patrick's question, which was you mentioned disease control and vaccination in Androscoggin County to try to address the outbreak there. What does that look like in practice?
Okay, so it started back in late March when we first were notified of an outbreak at Bates. And so we worked very closely with our colleagues at Bates. They already had an excellent plan in place to make sure students were in quarantine, ramp up their testing volume for those who were positive, to get them into isolation, to make sure they had access to the things they needed to stay in quarantine or isolation, like food, social supports. That's what I mean when I talk about the disease control piece. It's those public health interventions that Jessica, we've talked about for 13 or 14 months. And when I talk about disease control, that's shorthand for that work.
And what
then-
about vaccination efforts in Andrews
Okay.
County?
Yep. Let me just. I should have mentioned something as well. In concert with increasing rates of community transmission in and around Androscoggin County, we sadly saw some outbreaks at places like long-term care facilities, a workplace or two, things of that nature. So we then similarly, as you've covered for the past year, we worked with those places again to get testing in place, make sure they had PPE, make sure they were cohorting residents, and to keep levels of transmission down. On the vaccination front, our approach to vaccination in Androscoggin County has been one to rely upon the large scale site at the Auburn Mall to make sure that they had all the doses that they needed. They have been pretty regularly getting 2 trays of Pfizer vaccine, so about 2,340 first doses of Pfizer vaccine every single week, which is what we've been working on with them to administer. But we've also worked with the pharmacies in the area, whether it's a Hannaford's, a Shah's, Walgreens, CVS, what have you, to stock them up with as much vaccine as they could offer. We are also working with different groups and faith leaders in and around Androscoggin, in and around Lewiston and Auburn, to start thinking about how we can offer vaccines on site during worship times, things of that nature.
Thank you. And then more generally, maybe not in Androscoggin County, but the declines we're seeing elsewhere in cases, would you say at this point that does have something to do with more people being vaccinated, or is it just people, changing their behavior in other ways?
I think it's a mixture of at least 2 things. The first, and the predominant hypothesis, Jessica, is increasing rates of immunity, both from vaccination as well as those who have been previously infected. The combination of those 2 things is starting to reach a point epidemiologically where there may be some effect as a result of that. That's probably the predominating thing. Number 2 is folks are still continuing to do the right things when they're in grocery stores, when they're in indoor environments. That continues to play a part. And then the third is an open question for historians of epidemiology to help sort out, but whether there are impacts because of the weather, things of that nature, with increasing humidity, and also all of those factors that we've all read about and heard about over the past year, the impact that those are making. That's in the credit column, Jessica. Then in the debit column is what impact is the spread of variants having on pushing in the opposite direction there. So on one hand, we see those positive signs from immunity, behavior, perhaps seasonal changes. Those are helping keep cases down, but variants that we've detected are helping keep it up, unfortunately.
All right, thank you.
Over to Amy Brown next.
Thanks, Dr. Shah. First, following up on your answer to Patty White about herd immunity, in calculating progress toward that 75 to 85% range, will you be including people who have had COVID but have not had the vaccine? Do they have enough immune response to be included in that number toward herd immunity? And if so, do you have any idea how much those people boost up the percentage that we're currently at?
Yep, that's a good question, Amy. And we should not think of this as an either or a single number. We run multiple models using 1,001 different assumptions, partial immunity, partial differential immunity, all sorts of things. So I hesitate to say yes or no, because it's not as if we have one model and that is the only model, and that the only number that comes out of that is the only number we can ever use. We run models with different assumptions. That's what modeling is about. And you use different assumptions and you come up with different projections. So indeed, in some of the models that we look at, we of course count those who have varying degrees of natural immunity. But even there, that group of folks who have had COVID is not a monolith. Someone who had COVID on March 13th may not have the same depth of immunity that someone who had COVID on March 13th of this year versus last year does. So we build models that have different assumptions in it. How long that immunity may last. Is it 90 days, 180 days, 360 days? How quickly it wanes? That's part of how modeling works. You also have to go into those models with an assumption of how many people who have had COVID have now been vaccinated. So you can't necessarily have mutual exclusivity. You have to have assumptions for all of those things.
So if you added the people who've had COVID who are in the 50 and older range but haven't been vaccinated to the 2/3 of the people in that age range who've received the vaccine, do you have any sense of what number of people that comes out to, what percentage?
I'd have to run that model, Amy, but
Okay.
but in compartmental models of disease, especially SEIR type models, you don't want to just pick arbitrary age groups because we're talking about population level immunity. You've got to
Right.
account for everyone in the compartment. So you can't just
Right.
say this age group with the, it's not, that doesn't give you an answer that tells you anything about the real world.
Right. Okay.
Mm.
Are samples from everyone who dies with COVID automatically tested for variants now, or will they be now that we're seeing more deaths among younger people to see what's
It,
happening with that?
it depends on whether we've got a viable sample from their test. We make attempts to, but we don't always have a viable sample.
Okay, so do you know if the people, there have been a few in their 40s and 50s, and then, recently a couple in their 20s. Do you have any sense among that group of people in recent weeks who were younger than we had been seeing who've died, if any of those have been tested and if they've been related to variants?
I'm not sure, but we shouldn't use that as a metric for whether variants are more dangerous. The variants have been demonstrated in a number of countries to result in higher contagiousness, higher hospitalization rates, and higher deaths. Whether that's been the case so far in Maine or not should not stop us from taking the variants very seriously.
All right, thanks.
Over to Megan at WMTW.
Hi, Dr. Shah. Thanks for taking my question. I was wondering if you could maybe update us about if there are any current outbreaks or being investigated at nursing homes or long-term care facilities. And in accordance with that, or kind of going along with that, it's really, you can't force, administrators can't force people who work there to vaccinate. So what are recommendations? If you have a loved one in a long-term care facility or nursing home, I mean, what are the recommendations?
Mm-hmm. Well, we do have outbreak investigations that are open and ongoing at long-term care facilities, congregate living facilities across the state. And our recommendations for first, Megan, I think it's important to note how those differ from where we were a year ago. Although we do have outbreaks now, they are not of the nature that we were generally contending with a year ago, where outbreaks resulted in double-digit, even higher numbers of cases than that. It was not uncommon for outbreaks, unfortunately, a year ago to always involve a death, which was very sad. Nowadays, outbreaks, when they occur in nursing homes, which are far fewer than they were a year ago, they may not involve any deaths or generate any deaths. So I think it's important to note how far we've come, but also take stock in the fact that outbreaks are still occurring in long-term care facilities across the state. Our recommendations for the facilities, as well as for those who have loved ones in the facilities, hasn't really changed. Number one is for the facilities to try to get your staff vaccinated. We have worked with pharmacies as well as our own team of public health nurses to go on site to bring the vaccine to employees and residents. And after that pharmacy program wrapped up, we didn't stop there. We had a so-called bridge program, which made sure that places that didn't have everything they needed to take advantage of the program the first time could still get vaccine brought to their doorstep. We're still working with long-term care facilities that need vaccine to get them vaccinated. That's recommendation number one. But the other recommendations are the ones we put into place starting over a year ago to make sure that staff are fully fit tested, that there's enough PPE on hand to test people on a serial basis across the facility to look for signs of disease before they turn into outbreaks. Nursing homes in Maine have been hard hit, but have also done a great job of keeping their residents and staff safe in the midst of the pandemic. For those who have loved ones who are in nursing homes, I hear your concern. There's no question about that. But one of the best things that you can do for your loved one in the nursing home is to work with them and work with the facility to get them vaccinated.
Just switching gears slightly, can you just update us on the status of what the state is doing in terms of outreach to make sure that the populations who are disproportionately impacted by COVID are getting word about the vaccine and getting to where they need to go to get the vaccine? We've anecdotally heard that, some of the volunteers haven't seen a ton of people from those populations that are disproportionately affected going through the doors. That, of course, is anecdotal, but I just wanted to see what was in place.
Yep. Let me go back to vaccines really quickly, Megan, on long-term care facilities as well. One really important note there is some recent data that were published yesterday by the US CDC noted that the vaccines continue to meet, if not exceed, expectations. The data that the US CDC published yesterday noted that for people in their 60s and above, being fully vaccinated resulted in a 94% decrease in hospitalizations. 94%, virtually eliminating hospitalizations in those who are vaccinated in their 60s, 70s, 80s, and over. Again, for those who have loved ones in long-term care facilities and you're worried about COVID, I hear where you're coming from. Working to get them vaccinated not just keeps them free from COVID, it almost eliminates, reduces by 94% the likelihood that they need to be vaccinated. But Megan, you raise a good question about getting the word out more around vaccinated, particularly for hard to reach groups. What we've tried to do is create an approach that relies on three main factors. Number one are the proactive ads, the ads that are not so much focused on convincing you to get vaccinated, but addressing the needs of people who want to get vaccinated but don't know how to take the next step. That's one reason we put up a phone number, for example, months ago, which is still active. That's a number that folks who want to get vaccinated but maybe don't have internet access because they live somewhere where broadband is tough to get, or they're just not comfortable registering for something online. You can call that number and get registered for a vaccine just as if you were going online. So that's the first way that we've tried to make vaccines easily accessible, coupling the advertising with a way to call and get scheduled. Number two is to get rid of the need to get scheduled. For a lot of folks who are vulnerable, hard to reach, and disproportionately affected, they don't have control over their schedule. If you're working, you may not be able to know where you're going to be or where you could be at 1:45 p.m. next Thursday. You just don't have that degree of control over your schedule. So eliminating the need for appointments at a lot of places and having morning and evening hours makes vaccinating the easy choice. The third thing that we're trying to do is diversify the types of places where vaccines are available. It's all well and good to say that the Portland Expo, you don't need an appointment for, but if going to Portland is not easy or accessible for you, then we've got to diversify where vaccines are offered. The mobile unit is a good example of that. It's just wrapped up in Biddeford, but before that it was in Wyndham, and then before that in Oxford. It's now going to Freiburg, places of the state where there aren't these large scale sites already, but we can bring the vaccines to them. And then finally, there are a lot of folks for whom none of that works. These are folks that are homebound because they haven't been able to get out because they've got medical conditions. We are going door to door to them now, usually with vaccine in hand, so no one even has to leave their house.
Thank you.
Let me go to Cam Smith at WAGM next.
Hi, Dr. Shah. Are you seeing a drop-off in the number of people getting vaccinated here in Aroostook County compared to other counties in Maine? And is that a cause for concern?
Well, Cam, I'm glad you raised the county in particular, because I have been just so pleased with the partnership that has emerged in Aroostook County to get folks there vaccinated. And indeed, if you take a look at everyone, for all comers, Aroostook County is at the top of the list right now. I mean, of all people across the state, for those who are eligible for vaccine, I'm sorry, for all people, not just those who are eligible, but about 40% of people in Aroostook County have gotten the shots they need. That places it in the top quarter of counties. So folks in Aroostook County have gotten the job done, and my hat goes off to you. We haven't seen necessarily a slowdown in Aroostook County that is different from any other part of the state. We've seen folks in various parts of the state now, as I've said, we've got to do a better job of reaching them, but nothing unique about Aroostook County. And indeed, speaking of that mobile unit again, we're coming up to Aroostook County in coming weeks. We're going to be up in Madawaska, making sure that, again, vaccine is easily available to folks in places where it may be harder to get.
Thank you.
Yep, let me go over to Evan Pop next.
Hi, Dr. Shah, thank you. So you talked about focusing on getting younger people vaccinated. And so I recently heard that the governor of West Virginia announced that that state is offering a $100 savings bond to younger residents who get vaccinated. I'm wondering if any incentives, maybe something like that or something different that Maine is considering along those lines to reach younger people.
Yeah, I mean, I've seen that, Evan. I've seen that another state up here in New England is partnering with restaurants to offer a free drink. You know, we've looked at some of those. Again, you know, no final decisions there. We've seen pretty robust vaccine uptake. You know, in a way that, thankfully, for example, in West Virginia, although they were quick out of the gate, they've seen a unfortunate decline in demand. And so I do wonder whether some of these are in response to the swelling of demand. We've seen a little bit of that here in Maine, but thankfully overall as a state, we're still seeing strong demand. And so we haven't made any final decisions on that, Evan. I guess the way that I think about this is that there are those fiscal or, you know, alcohol-based incentives that are out there. But I also think it's important to make the case for getting the vaccine on its own terms. You know, as we talked about earlier, getting vaccinated if you're a younger person nearly eliminates your chances of not just yourself getting sick, but spreading it to others and people in your community who are elderly, for whom the vaccine may not be as easy to get, so on and so forth. It's also the thing that allows us to do things like remove the outdoor mask mandate and not need to quarantine. So right now, Evan, I'm focused on making the case for the vaccine on its merits, but we're also, and no final decisions on the other incentives as of right now.
Great. And my second question, I realize this is not something that you are in charge of, but given your expertise in public health, I'm wondering what your thoughts are on the push by some advocacy groups and US senators to get the Biden administration to back a temporary patent waiver on the vaccine so that other less wealthy countries can more easily produce it.
Yeah, you're right. Not not something I am the decider on. You know, Evan, there's a lot to be said there. Given what we are seeing unfolding in other countries, South Asia being just the latest, there is definitely a logic to releasing the recipe. At the same time, it is important to keep in mind the ways in which highly technical vaccines, particularly mRNA vaccines, differ from blood pressure medication. That is to say, releasing the recipe is the first step, but as with many complicated recipes, I don't want folks to think that that is the only step. And that's my concern with much of the dialogue. There is a notion that if the patent protection is removed and the patents are issued or a compulsory license is issued, then folks will say, okay, well, job well done. But in the same way that if you went to the top cake maker in the world, even if you got their recipe for their best in the world cake, even if I gave you that recipe, that doesn't mean you'd be able to go home and replicate that. And that is some of my concern with the dialogue and discussions I've been hearing. If we want to have this discussion, all well and good to start it with patents, but we've got to make sure we follow it through, because making mRNA vaccines or making adenovirus vector vaccines is extremely difficult. Some of those patents for other vaccines, like the AstraZeneca vaccine, have already been amended so that COVAX and Indian manufacturers are already making them. So as you can see, very technical discussion, but I'm open to the idea. I just want to make sure we think it through to the end.
Great.
And then as to your former question about incentives, I'm still interested in a shots for a shots campaign, but that's something later. Let me turn to Emily at the Sun Journal.
Hi, Dr. Shah. I want to bring the focus back to Androscoggin County. So what I've been hearing is that the high number of cases is from community spread. I've heard from officials in Lewiston and Auburn who've said mask compliance is great, social distancing is great. So if this high case count is spreading through people going over to their friend's house and then they're going to another friend's house, how can we, or how is the CDC looking at controlling that, considering that cases on average are declining but are still very high?
Yep. Well, you're right, Emily. It's a good sign to see that there's been a decline in recent days. Number of new cases there has eased, and let's hope this is the beginning of a more durable downturn. But you're right. The nature of community transmission makes it very difficult to control, because much of that transmission is occurring in non-public settings. We can do everything we can to tamp down the likelihood that when a group that one of whom may have COVID goes to a restaurant or goes somewhere indoors, they don't spread it to others. But right now, Emily, the number one tool we've got is vaccination. We're really focused on making vaccination as easily accessible in Androscoggin County, including bringing on other sites if needed to make vaccine accessible and easy, whether that's downtown in Lewiston, or as I mentioned, working with faith leaders to make vaccination the default option. That is by far the most effective option that we're going to have.
I'm wondering if you could also update us on the number of variants. I heard from one official who suspected the reason it's the cases in Androscoggin County are so high is because these variants are more contagious. And I'm wondering what your insight is on that.
Well, it's possible, and we are continuing to detect variants, but I think it's important to note that variants are not a county by county phenomenon. The nature of variants, particularly at a state level, is it's not as if they are somehow confined to Androscoggin County. If what was driving what's unfolding in Androscoggin County were truly a function entirely of variants, then we would expect to see high case rates, not just there, but in adjoining counties, as well as perhaps elsewhere east as well. So I think a lot of what's happening in Androscoggin County is transmission in the fashion that you noted. There certainly may be a component of it that is variant driven, but it's difficult to see why that would stop at the county borders.
And my last question, you've talked before about breakthrough cases. Duville Pavilion in Lewiston recently said that they had 3 staff members who tested positive, all of whom had been fully vaccinated. And I'm wondering if you are aware of those cases, and if so, that just 3 people seems pretty significant considering there's only been about 107 breakthrough cases in Maine so far.
Well, it's a large facility, as you're aware, and that's a population of folks who are more likely to get tested on a frequent basis because of the nature of their work. But again, I think what's important there is, although we should be focused on breakthrough cases, no vaccine that's ever been created, no medicine that has ever been developed is 100% effective in every single person who takes it. What I think is important is, again, to focus on making the case for why being vaccinated is so critical right now. And again, in Maine to this day, 99.97% of people who have been vaccinated have not gotten COVID. It's also important to note that since we rolled out vaccines as a country and as a state starting in December, we've had about 44,000 new cases of COVID, 44,000. And again, we've vaccinated now about 501,000 people. Of those, roughly 100 or so have had breakthrough cases. out of 501,000. So again, about 99.97% of people who have been fully vaccinated have not gotten COVID. If you were to walk up to somebody on the street and say, look, you've got this disease or you might be at risk for this disease, I want to give you this medication that will basically reduce your likelihood of getting it. For a person to say, well, look, you know, it's only 99.98%, I don't know, that's not good enough for me. That doesn't strike me as right. These vaccines are exceedingly effective. That's where I think the focus should be. Let me turn next to Brian Sullivan.
Thanks, Dr. Shah. You mentioned boosters earlier. About maybe 5.5, 6 months ago, started giving out shots to frontline workers and elderly. Any thought or what's thinking around the need for a booster for that group of people, or any, I guess, for that matter?
No boosters have been recommended or authorized or discussed by or endorsed by either the US CDC or the US FDA at this point. I know there's a lot of scientists that are researching the extent to which boosters might be needed, but at this time, none of those federal or frankly international health authorities has recommended or authorized any booster doses.
Okay, is the Maine CDC or the state still asking restaurants to get information from their customers in terms of names and phone numbers in the event that they need to be contacted?
I believe so, Brian, but I'm going to double check and we'll get back to you. I'm going to make sure that that's accurate. But just to be sure, this was just a first name and a phone number of one member of the party, just in case there were an outbreak and others needed to be alerted and contact traced. This was not the name and personal information of every single person, just a first name and a phone number of one person in a party, just in case there were an outbreak. That was the only basis of it. And we'll check on the latest status of that.
Okay, that was all I had, but I would love a little clarifier on your Shots for Shots campaign if you.
I'm pretty sure that one's going to get shot down. The last question for the afternoon goes to Cindy Williams from News Center.
Hi, Dr. Shah. Thank you so much for taking my question. You talked a little bit about cases in congregate living facilities. I just wanted to move to the jails and the 30 cases at the Two Bridges jails in Wiscasset. Of course, Cumberland County is sending prisoners to them because they have an overflow. And of course, the state prison also had an outbreak. How are you handling at this point? And at what point do you feel like there's going to be extra measures that need to be taken simply because the jails are so crowded? And also, what is the vaccination rate among prison guards there and
Sure.
among inmates as well?
Great. Well, I'm glad you raised that, Cindy. Yeah, we are concerned, particularly as you noted at Two Bridges. You're right. There are 27 residents and 3 staff that have been noted there. That outbreak in particular has been one that we've been focused on, working with them to make sure that they are able to keep residents safe and apart from one another to avoid any further transmission. But that site in particular is of concern. Similarly, as you noted at the Women's Center, they too, I believe, have now found roughly 20 cases. I think 24 is the most recent number associated with residents of that particular unit within the facility. The approach that we're taking, theme for the day, is getting folks vaccinated. We've been working with the Department of Corrections, and they in turn have been working with county jails to get not just staff vaccinated, but residents as well. Indeed, yesterday and throughout this week and into next week, Westbrook Public Safety has been working with the Cumberland County Jail to offer vaccines to residents there. Whether those residents are there for 28 days or not, it's time that we make sure they're getting vaccinated. Similarly, at other jails, for example, in Penobscot, our colleagues at Penobscot County Community Health have been making visits to the Penobscot County Jail to offer vaccines there. That again is going to be the way out of this. But Cindy, I also think, although we remain concerned about outbreaks and cases in prisons, I just want to offer this. I don't want to minimize this one bit, but I do think it's important to just once again take stock of where Maine has been and how well the measures we've taken to date have served us. You take a look on the Marshall Project's website, the Marshall Project being a journalist group that is focused on criminal justice and prison conditions. They have a running tally of the number of cases that have been detected in prisons across the country. And Maine has had 175 cases amongst its prison system. That is less than 2.5 times next to our closest state, which is New Hampshire, which has had 458 cases, 459 in Vermont, 630 in North Dakota. Maine is literally 50th out of 50 in the kind of table where being at the bottom is a good thing. Now we've had cases, we're seeing cases in jails, as you note, and we're taking action to offer vaccines on top of the things that have already been done. So we're not sitting still on this. We're now moving to vaccinate more folks. That's got to be the strategy we put into place to keep those settings as safe as possible.
Excellent. One other question on Androscoggin County, since it keeps coming up. Are you saying or seeing a direct correlation between regions that have lower vaccine uptake and then higher positivity rates? Is that what we're talking about in Androscoggin County?
Yes and no, Cindy. So yes, in Androscoggin County, which is to say a lower percentage of folks who have completed their vaccination series and a higher rate of disease. But at the same time though, Cindy, if you look at counties that also have low vaccination completion rates, Oxford, Somerset, they don't have the same high case levels. So I think the way I think about it, Cindy, is the lower vaccination rates in Androscoggin County mean two things. Number one, we've got more work to do as a state to get folks there vaccinated, to offer a vaccine, to make it convenient. No question about that. We've got our work cut out for us. Number two, the lower vaccination rates in Androscoggin County contribute to higher rates of disease. They are part of the story, but they are not the whole story. There is still the communication that I think Megan raised. And Emily as well. So thank you for raising that, Cindy.
Okay.
Before we wrap up for the afternoon, just a reminder to folks who are watching right now, who are in their 20s, 30s, and 40s. But 1 out of every 5 people in that age category, in your age category, has been fully vaccinated, compared to 2 out of every 3 among people in their 60s, 70s, and 80s. Vaccination across the state now is open to anybody, and we're trying to make it the easy option for everyone across the state. But I want to again remind those who are in those younger categories of folks that getting vaccinated is the smart thing to do. Even if you think that you're healthy, that you would not be affected by COVID, I'd urge you to think about those around you. You may be interacting on a daily basis with folks who are older. You may be working on a frontline job where you're interacting with all sorts of different folks. Getting vaccinated is the right thing to keep not just yourself safe, because as we've seen just today, another person in their 20s dying. It's also the right thing to do to keep everyone in your community, your parents, your grandparents, those you work with, to keep them safe as well. We're trying to make it as easy as we can for you to get vaccinated. I'm asking you to do your part, to take us up on the offer to go get your shots. The sooner we all get vaccinated, the sooner we will be at the other end of this tunnel. So with that, thank you all for your questions today. Thanks to those who have tuned in for your time. I look forward to chatting with everyone again next week. In the meantime, as always, be kind and take care of one another. We'll see everyone soon.